Hi, I'm Anne. Thanks for coming back to my channel. This is Intentional Joy Beyond 60, and I truly hope that you are seeking out moments of joy every single day. I wanted to talk to you today a little bit about Ontario Health at Home. If you have watched my other videos, you may know by now, I have worked for many years in senior living and for many years before that in home care. And so I'm very familiar with Ontario Health at Home. They used to be called, when I first started out, they were called the CCAC, Community Care Access Centers. Then the name was changed to the LHIN, Local Health Integration Network. It's a government-run organization, and so the government, in its infinite wisdom, decided to change the name and rebrand, and it's now Ontario Health at Home. And I don't think they like being called OHA, so it is what it is. Anyway, the Ontario Health at Home folks are comprised of healthcare professionals from many different disciplines. You will find care coordinators who are nurses, who are physiotherapists, occupational therapists, all sorts of different healthcare professionals work in Ontario Health at Home. If you are living at home in the community and you become ill, or you have a fall, you go to hospital, you have surgery, let's say you have a hip replacement or something, and you need help at home when you get back from the hospital, or just, if you're starting to age and things are becoming more difficult for you around the house, Ontario Health at Home is really the first place for you to call and seek out some community supports. Your doctor may discuss this with you, but you can just initiate the request for a referral on your own. The Ontario is divided up into, I believe, 14 geographic locations for Ontario Health at Home. So I will post the phone number in the link so that you can access, and I'll also post the website so that you can access their referral process. All you need to do is give them a quick call and say, I need help, or I'm calling on behalf of someone who needs help, and they will start the process for you. They'll start with a phone call. They'll have a care coordinator call you, or an intake coordinator call you, or call the person that you're calling on behalf of, and just check in to make sure that you really want the service, you require the service. They'll get some preliminary information. Then from there, they will schedule an appointment for you to have a visit from a care coordinator. That person will come to your home. They'll do an assessment. They'll chat with you and assess your requirement for care and services. They'll also determine after that visit what you're eligible to receive. And it varies from person to person what people are eligible for and what services they end up getting. It may be that you're someone who needs help getting up in the morning, and if you're living at home in the community, in your own home, and let's say your mobility is declining and you're at risk of falling, you may be eligible for more hours of support than someone who, I don't know, just needs minimal help. So they'll determine how many days a week you'll get services, how many hours or how many minutes at each visit you'll get services. Usually, if you're living in your own home in the community, they'll do an hour visit each time, because the PSW who's coming out also needs to be paid. The service provider needs to be paid. So they usually book those visits an hour at a time. If you're living in a retirement residence, they may say you only need 15 minutes in the morning for us to come in and help you to get dressed, help you to brush your teeth, and then we'll come back in the evening and give you another 15 minutes to help you get into your pajamas and get into bed. So it varies, the amount of services that you will receive and what the criteria is for providing those services. If you need help with equipment in your home, for example, if you're finding that, in the bathroom, maybe your toilet seat isn't high enough, maybe you need a pole in your shower to help you to stay safe, they can refer an occupational therapist to come to your home and assess your safety, your level of safety in your home, and recommend and order some equipment for you and have it installed. They can also do that for you if you're living in a retirement residence. If you are someone who needs help with activities of daily living, getting up in the morning, having a shower, getting dressed, usually that's kind of the basic care. If you really don't want that type of help, then it's possible. I mean, it's still worth asking them and still worth having the conversation, letting them come out and do the assessment. But it is possible that you may not qualify for care if you are not prepared to have them help you with the basic activities of daily living. If you just want someone to clean your home or cook a meal for you, they may or may not provide that without doing the basic care as well. So, as I say, still call them, do the referral, get them to come out and do the assessment, and then have that conversation and see what they recommend if you really don't want the basic care. If you go and you get that all arranged and they come and do the assessment and they tell you, yes, you're entitled to so many hours a week, let's say 3 hours, 5 hours, whatever it is per week, they will refer your services to a third-party assessment or a third-party service provider. So there are many service providers who will provide personal support services out in the community and in retirement residences. Or even in hospital. So the Ontario Health at Home folks have a contract with each of those companies. There's an approval process companies have to go through to be considered a preferred vendor with the Ontario Health at Home folks. And so they will then decide which company is going to provide the services to you. And so there will be a supervisor from that service provider, and that supervisor should come out and do her own assessment or his own assessment and make sure that they're setting you up correctly in their system, that they're matching you up with the PSWs that are going to be able to provide you with the services that you need, and that the information on the referral that they got from Ontario Health at Home is actually correct. You know, things happen, sometimes mistakes are made, and so it's good for the supervisor to come out and determine if you have a pet in the home, and you know, maybe you need to put your dog in the bedroom while they come and provide services for you. It's good for them to come and see the home, see the equipment that their employees will be working with, determine if there are any hazards in the home, and make sure that they have the right fit for you in terms of staffing. So fit is important. They work hard, they strive to ensure continuity of care, so they will try to make sure that you have the same people coming into your home regularly as much as possible. Of course, people have to take vacation, people get sick, and so they usually try to have a backup plan of a backup roster of people that they can send in the event that your primary person is not able to come. If you, for some reason, don't need the care, if you have a family reunion or something to go to and you want to cancel a visit, then you will call the service provider and just let them know in advance. Likewise, they should be calling you if they're having trouble filling a visit. If their primary person has called in sick and they're not able to send a backup person to you, they should call you and let you know that. And then ask if, you know, maybe they can change the timing of the appointment. If you're scheduled to have someone at 8 a.m., is it okay if they send somebody in at 11 a.m. instead? Or can they move the visit to tomorrow if you don't get services every day? So these are all of the things that may happen if you have help from Ontario Health at Home. If you are looking for a retirement residence and you're considering a move, your services could move with you. You may not necessarily have to give up your services entirely. You will be reassessed. They may determine that you no longer require as many hours in the week of service as you did when you were at home alone in your own home. But you may still get services. And so that's a conversation that you should have. The other thing to ask your care coordinator about is if you're considering one retirement residence in particular, if you've done your search and you've done your visits and you found your favorite and you're thinking that's where I want to live, talk to your care coordinator, because they will have one company go into each retirement residence. So the company that is providing services to you currently in your home in the community may or may not be the company that goes into that retirement residence that you want to move into. So if that's important to you, if you've had a really good experience with your service provider and you want to make sure that you get the same PSWs or the same company in the retirement residence when you move, you need to ask your care coordinator about that, because it could be that it's a different company in that building. And even if it's the same company, there's no guarantee that they're going to have the same PSWs working in the retirement residence as they do in the community, seeing you in your home. So you really want to ask about that and have that conversation. Now, when you move into a retirement residence, you still have the option of paying out of pocket privately for services. So if you've had a really good experience with a service provider and with a specific PSW that you just love and you've really connected with, and you move into a retirement residence and you feel like, you know, they're only giving me 1 shower a week, but I need 2 or 3 or whatever, you could hire privately. You could pay that service provider privately. Most service providers do private contracts as well. And so you could potentially pay privately for that person to come and still assist you, if that's something that you want to consider. Lots to think about, lots to talk about. If you have any questions about Ontario Health at Home and how all of that works, by the way, the care coordinator for Ontario Health at Home, who will assist you and support you with your home care, is also the same person who will support you in applying for long-term care, if and when you decide that's necessary. When people move into retirement residence, I usually it's been my practice to ask if they've started an application process for long-term care. Very often when people move into a retirement building, they've waited a long time. And so very often, in Ontario at least, we're seeing people in their 90s, you know, late 80s, early 90s before they're coming into retirement residence. And so the wait lists can be very long. Now, I've heard of some wait lists that were fairly decent and short, you know, 1 to 2 years. I've also heard in some areas of the province where the wait list can be 10 to 15 years for a bed in long-term care. Long-term care is managed by the government. It's different from retirement, and I'll do a whole separate video on that. But that's a process that I think it's prudent to start early, because a lot can happen, you know, in 5 or 10 years' time. You just don't know. So I always ask that question, and I think it's a good conversation to have with your care coordinator as well, and they can guide you through the process for that as well. But again, I'll do another video on that. We'll talk about that in greater detail. I hope this has been helpful. If you have any questions about home care in Ontario or wherever you may be, I'm happy to look into it further for you. I do have some experience with home care in other provinces in Canada, but primarily my experience has been in Ontario. So as I say, if you have any questions, please leave a comment. I would love it if you'd leave a comment anyway. If you are finding value in these videos, please consider subscribing. Hit the like button if this has been helpful at all, and I will see you next time. Thanks so much. Take care. Find joy.